nobody is arguing against capping spending around here. The only difference is this law empowers the IPAB with the unilateral power to decide how to live underneath that cap. And where we have an issue with, you mentioned affordable care organizations, there isn't a Wisconsin provider that's willing to sign up for this. The ACOs. Right. What our concern is if we invest all of the power and the funding decisions with a board of 15 people whose decisions go into law don't even go through Congress, is that the best way to save this entitlement and to restrain spending? We believe there's a better way, and we believe giving seniors the choice, like we did with Part D, is a better way, because what it does at the end of the day is it shows providers, if you want to succeed, if you want to have business, you got to outcompete other providers for that beneficiary's business. So the nucleus of the program we're trying to talk about is the patient, the beneficiary, not the IPAB. And there's the big difference at the end of the day. We really believe, because of evidence and reality, giving seniors more choices, where providers, doctors, hospitals, insurance companies compete against each other for that beneficiary's business, that works. More importantly, you talk about what this would do to future seniors. We think we should give more money to low-income people, more money to sick people than to wealthy people in the future of Medicare. And if we do it in a way like we're proposing, you don't have to do all of this to the current population. You don't have to have IPAB start their indiscriminate price controlling in 2013. You don't have to do any of that. You don't have to affect benefits for people above 55. And we can cash flow and borrow the money to cash flow that generation if we reform our generation, those of us under 54. And in the way in which we think we ought to do that, more money for the poor, more money for the sick and the middle income, and less money for the wealthy. It's an idea that used to have bipartisan support. It's an idea that came out of the Clinton 1999 Bipartisan Commission to Save Medicare. It is a very good and legitimate debate to debate about growth rates and how you grow a payment and what should it be, GDP or GDP minus this or that. That's a very fair debate. But at the end of the day, where I think we have a disagreement is we don't think we should invest all of the power and money decisions into the hands of 15 people who aren't even elected versus giving seniors the ultimate decision and controlling how their health care is to be delivered. Because if we just simply give 15 people the ability to unilaterally underpay providers, and we see where this is headed, what's going to end up happening is providers are just going to drop Medicare. I don't know what you call that, but I don't know. It's rationing under a different word. Because if you say to a provider, we're not going to pay you anything close to what it costs to provide this service, they're not going to provide that service.